Good evening, everyone, and welcome to the webinar. My name is Bianca, and I'm here tonight with Dr. Richards.
Hey,
Hello.
how you doing, Bianca?
Good. How are you?
Good.
Been a good
well,
week so
thanks.
far.
Yeah.
And tonight we're going to be talking all things dental implants, as I'm sure you know. So thank you for joining us. We are so glad that you are here, and we are so glad to be able to answer all of your questions tonight. And we already have some good ones coming in, which is great. So I love that. We will go ahead and just kick things off.
Okay.
And learn a little bit about Dr. Richards. So he is a board-certified oral and maxillofacial surgeon since 1982. So he has over 40 years of dental implant experience and is an innovator of the New Teeth Now process, which we will discuss in detail tonight. And I always love asking your perspective on this, since you have been here since the very beginning, is how have we seen New Teeth Now, evolve and change into what it is today?
Well, I think primarily the recent digital stuff has been the most interesting, and the accuracy of the digital impressions and the bite and all that kind of thing has allowed us to provide a better product, same-day product. Mm-hmm. So when you take the digital impressions, it's called a MicronMapper. We're going to highlight it a little bit later in the webinar. And you combine that with printing teeth that we give our patients on the same day of the procedure. It it's just an accurate fit. I mean, the impressions that used to take, 4 or 5 minutes for these different materials to set, and then, you might have to redo it. The MicronMapper takes an impression in like 10 seconds or less, and it's just dead on accurate. And so you combine that with printing technology and the designing the teeth in exocad software, and I think this has probably been the biggest thing I've seen in my entire career.
Yeah. It's a big difference.
That and the routine and just Lord knows how many zygomatic implants we've done.
Yes.
Back in the early days, no one even had heard of a zygomatic implant back in the 80s, and Chantal Malavez had not yet introduced that concept in Belgium. And so, in the early 2000s, somewhere around 2005 probably, we began to get introduced to the zygomatic concept, and of course now, I think we lost count at 2,000 of those things or something like that. Allowing us to give people a non-bone grafting solution when they don't have any bone in the rear part of the upper jaw. So I'd say the routine use of zygoma implants and the technology allowing us to make better same-day teeth has probably been the two things, mm-hmm. over the years that have been so the benefit of our patients, we can give our patients a better same-day product with that technology.
Yes, definitely, and we will be discussing those in detail as well. And we had a few questions come in, which is perfect. So let me see. So someone said, I need several teeth pulled for implants and need a consultation in person. Would it be better to wait for my consult instead of having the teeth pulled first?
Not necessarily, no. You could have the teeth removed. I don't think that'd be a problem. If it's just, 1 or 2 teeth, and you can go without those teeth. I mean, if you were talking about front teeth, you probably, would be more interested in having the teeth pulled and the implants placed at the same time. But mm-hmm. if they're teeth more in the posterior, it wouldn't be a problem to have the teeth out, particularly if they're infected or sore. Mm-hmm. It'd be better to get those out.
Awesome. And then last one for now is, how long is typical recovery?
Well, and I'm assuming you're talking about a full mouth procedure.
Yeah, we can assume that, I think.
And it depends on what you call full, like going back to work easy in 5 days. Lay around the house, and relax. Have your spouse do all the laundry for the first couple days for sure. But, the first couple days you lay low. And then at the end of probably 5 days, 7 days for sure, taking a week would be plenty of time, depending on what kind of work you do. Now, if you do tough physical labor out in the heat, that might be one thing. But, if you're inside in the air conditioning, you'd be fine in a week. No problem. Driving, you wouldn't be taking narcotics. So hardly ever, I'm not going to say never, but hardly ever see a person having difficulty out beyond the first few days. And if they are, it is almost always the teeth that are literally squishing the tissue. And so when a person calls and it seems that they're unusually sore or tender, beyond what we normally hear, which is nothing, then we encourage those folks to come in, let us take the teeth out, and almost in every situation, it's the teeth. We have to trim away some of the plastic on the teeth so the teeth can be replaced without squishing the tissue. So,
Gotcha.
yeah, recovery time 5 to 7 days with a full mouth.
That's excellent. So for our hybrid procedure, which is the upper or lower full mouth or tooth now procedure, we'll just show a slide because it sometimes helps just to see what would actually be happening. So what are viewers looking at here?
So you're looking with Superman eyes, I always say, because you're looking through the tissue, through the bone, you're seeing the implants and how there's a relationship between the teeth and the implants. So fixed means that it does not come out. Upper, of course, means the upper jaw. And hybrid, usually hybrids are screw retained. It's not like crown and bridge work. There's a little bit more artificial gum with the hybrid kind of a technique. And also the position of the implants does not necessarily have to be in the position of the teeth. So the teeth and the implants are disconnected. So the implants go where the bone is located and the teeth go where they need to go to look good and chew good. So.
And then kind of the same
thing
concept.
In the lower, yep.
And this is just a very brief overview of what surgery day would look like. So you'd come in early in the morning, about 7:30, and you're put in a deep sleep with general anesthesia for a completely pain-free procedure. If you do have teeth, they are first extracted, and then Dr. Richards would place all of the implants that you need. And while you're still asleep, he will take impressions, which is now our MicronMapper, for the lab to customize the teeth same day. And then the patient will wake up in a private recovery room while our lab is creating those teeth. The teeth are then placed in the patient's mouth in the afternoon and adjusted, and they are sent to go home.
Right. Pretty good overview.
Yeah. And then this is where we can talk about our innovative technology with the MicronMapper.
Yeah, the MicronMapper we've been using now for about a year. And is there a video that goes with this, or?
Yes, I believe so.
Yeah, there you go. So this is an amazing instrument. It takes the impression, and so some of you may know what I'm talking about, others may not, but we put scan bodies, and these scan bodies allow the MicronMapper to do what you're seeing right here. When that circle around that scan body turns green, that means you've got it. And that typically takes about 10 seconds. Now this is an intraoral scan. This is not the MicronMapper. This is an intraoral scan of the teeth. This is a scan that Terry's doing upstairs. But we do a lot of scanning now, a lot of intraoral scanning of the occlusion, which is a dental term used to indicate the way the teeth come together. So the MicronMapper was the first thing that you saw, and these are scanners that are scanning impressions. So the technology is amazing. So this shows that the teeth have been designed in our milling center by our designer, and then that is emailed back to our main office on Hardin Boulevard, where Terry takes that information and prints the teeth with a 3D printer with a material called onyx. And that just shows the teeth after they've been printed. All of those sprues have to be removed, and then the gum color is painted, and the teeth may be stained or may not be. And so that's an example of a printed set of teeth that would be placed into someone's mouth at the end of the day. And these are made using all of that technology that we just talked about.
Yes, it's really an awesome innovation that we've
yeah, and the
doing.
fit on these things, when I'm talking about the fit, you have the abutments that are attached to the implants, and there's 6 of them. And so you have 6 360-degree interfaces that have to all come together at the same time in order for the screws to go in passively and fit. And the MicronMapper does it in under 10 seconds. I mean, it's the dangest thing you ever seen, really, if you're not
That's
used to
awesome.
that. So I think a lot of people are using this technology now. There's no way you could ever go back away from it.
Yeah,
you know?
definitely. We had a few more good questions come in. Have you ever seen a mouth so bad it needed pre-treatment before the full mouth procedure could be done? I have gum disease and rotten broken teeth,
It needed pre-treatment.
including wisdom teeth.
I haven't yet. Last week we did one that was on a mentally challenged person, and I didn't know that we were going to be able to get the scans. They had periodontal disease so bad their teeth were about to fall out. And we didn't know how well they were going to cooperate or not. Fortunately, they did, and we were able to scan their teeth and gums. And you see, that means we don't have to take impression with these materials that would go down your throat and gag you, that take 90 seconds or longer to set. So we just scan this person, and the person did very well with that and enabled us to go ahead. I've done some terrible, terrible periodontal cases without any sort of pre-treatment. And typically, this individual I was just talking to you about had that, and have done a couple just recently with terrible periodontal disease and bone loss. And all of those folks seem to do very well. You know, once the teeth are gone and everything's cleaned up, the infection's gone. So.
And the last question for now is, Susan asked, is this just for the upper teeth?
No, upper and lower.
Yes.
We probably, most of the procedures that we do are both jaws. But the uppers and the lowers are probably split about half and half. And you know, we try to talk people into keeping their teeth if they're worth keeping. Some people want to keep teeth that aren't worth keeping. Other people want to give up teeth that are worth keeping. So there's no rhyme or reason to it. We run them all through our dentist, our in-house dentist. And if I can't talk them out of it, then sometimes Dr. Dibbs can talk them out of having their teeth out. But in the final analysis, if we fully inform the person that their teeth could be saved if they wanted to go that route, and we give them all their options and the risks and the benefits of both options, then what a person decides to do for themselves is their business. So, yeah, we have had situations where we removed some teeth that could have been saved, but it's in that, you have to put it in context to get,
Right.
that person wants to get to point B from point A, and sometimes this type of treatment is the easiest and the quickest and the least costly and the most long-term stable.
Yes, definitely. All right, and we are all in one day, which we've kind of mentioned a little bit here, and we're also all in one office, so that means that our surgeons, our dental lab, and our restorative doctors all work together, which is a benefit for really the patient because the communication is under one roof. You're not driving to different facilities, and we just have it. I feel like it's just a better outcome because we're all on one team, creating that final product for the patient.
I had that discussion today with a couple from Tampa.
Yes.
And this is a concept that we discovered probably 15 years ago when you're doing complicated things. If you can have everybody all in the same building in case there's questions or issues, or if we need the restorative doctor to be working with the surgeon while they're asleep, we just have everybody there, and I can't impress upon you how important this is, particularly in complicated situations.
Yes, definitely. And we also have 3 locations. So our office here in Lakeland, that's where we are at tonight, where Dr. Richards and Dr. Kirkpatrick practice. And then we have an office out in San Diego and also in the Villages. So pretty much wherever you are in the U.S., you are at least halfway. If you're like in Kansas, you got 2 options, I guess. But you're close enough to one of the locations, even if you're out of state. And how's the out-of-state process work? Do you want to briefly tell people that are out of state?
We started seeing out-of-state patients quite a few years back. And seeing out-of-state patients is what led us into temporary zirconia teeth. We would see somebody from, say, Alaska. I've seen 3 people from Alaska. And, you do the surgery, you put them in the old style, same day temporary teeth. They're plastic. And they go home, and 2 days later, teeth pop out, the teeth break, something of that nature. And, it's like a major deal to come back to Florida. And so we started experimenting with zirconia as a temporary. And so we are still doing that. We put people in printed teeth on the day of the procedure. And then if they're going to go back to their home state, we would like for them to wait 2 or 3 days. Then we look them over. We see how the printed teeth look, see what changes they would like to make or we would like to make, and we communicate that with our designer. The designer makes a set of zirconia teeth in about 3 days, and we put those in towards, let's say, the end of the week, and they go home. But they go home in a set of zirconia teeth that we still consider to be temporary, but they are zirconia. They're just like the final teeth. The difference is they're not adapted to the gum tissue as well as the final teeth ultimately will be. And so since we have started doing that, problems have gone to just about 0.
Yeah.
As the zirconia teeth don't break, and we've seen a few people have some loosening and things of that nature, but there's some little things that we have done with milling directly to the abutments and avoiding the cylinders that come unbonded. So that's been a really good thing for the out-of-state people, to send them home in zirconia temporaries.
That's a really huge deal,
yep.
Definitely. And we do have a video, but we had a couple more questions come in.
Yeah.
Carlo asks, is there any risk of losing control of my bladder or bowels during or after surgery? I've never had general anesthesia, so that's one of my concerns.
I can't think of anybody losing control of their bowels. We have had some people urinate while they were asleep or waking up. but that's not a big deal. Just like any anesthetic in the hospital or anything like that. But yeah, I don't think that would be a major concern. We may see that just every once in a while, but not often at all.
And then Susan asked, how quickly could I get this scheduled and done? I'm going to Europe in 4 weeks and wondered about doing this before or after my vacation.
Do it after. If you're going to go to Europe in 4 weeks, definitely do it after you get back.
And then
by the time you could get in to see us, get a medical clearance for
it would be
anesthesia,
kind of rushed, probably.
I think, I'd schedule them, booked up already through the end of the month, and, it'd be sometime in March before I could get you scheduled. So, do it when you come back.
Yes, definitely. Perfect. So we're going to hear from Jennifer. So Jennifer had bone loss and periodontal disease, and she just kept putting off, taking care of her teeth. And so we're going to hear how New Teeth Now has changed her life.
What's going through my mind is that that's the old Jennifer right there, and the old smile. Thank God I did something new. My name is Jennifer, and I'm a real patient at New Teeth Now. I came to New Teeth Now because my teeth were just messed up, and I had 90% bone loss. I had periodontal disease. It did accumulate over the years, but I also kept sweeping under the rug. I'll deal with it later. I'll deal with it later. And so it just caught up on me, and I couldn't deal with it later. My jaw would hurt, my ears would tingle. It just hurt to eat. It is painful. Hot or cold stuff was very sensitive, and my teeth would not stop bleeding. To the point I'm driving down the road to the dentist, spitting in a cup because I did not want to swallow it. And he was like, I can't help you here. You have to go see a specialist. So that's when I ended up at New Teeth Now. So I went in to see Harley Richards, board certified oral surgeon. He went to school for it. He knows. And I like how he gets excited about like new equipment he gets and stuff, and kept me at ease, talked me through all my steps. I got up early that morning and I was nervous. I could tell you I was nervous, but once I got in there and they put the little happy gas, let me go to bed, I woke up and I was fine. Holy cow. Oh my God. Oh.
They do look pretty nice.
Ew.
Yeah, they look really.
I love them. Oh my God. That's $1 million smile right there. They did amazing. Amazing. They just feel good. Thanks to New Teeth Now, I can eat what I want. I feel good about myself. I can be comfortable in my own skin. I can smile. I can be healthy. I can do the things I want to do. It's a total booster. I smile more now. As before, I would just hide them. And now I'm just all smiles. Every time somebody looks at me, they're like, you just keep smiling. I'm like, I have so much to smile for. If you're on the fence on it, do it. You won't regret it. You only live once, and if it's an issue and it's concurring and it's been like this for years, you wasted all this money in this past couple of years. What is a little bit more to get it right? Just do it. You won't regret it. It's the best decision I've ever made. Because that's $1 million smile right there. Nobody can take that away from me.
So as you can see, now she has so much to smile for, and she really, feels like this is the best decision she's ever made, which a lot of people that we talk to feel that same way, that, because it just changes your whole life. It's such a transformation for way more than just your smile, It affects so many other aspects of your life. So it was good to see that in her story. And then if we are looking at some x-rays, this also can be very helpful for what could be.
There are 5 implants in the lower jaw, and there's 6 in the top jaw. And that far right one and that far left one, they're at an angle to avoid the sinus. And if you look at the tilted ones, And then you look at the piece that goes into the tilted one, it kind of straightens it up. That's the abutment. That's a 30-degree abutment. Same on the lower. So each of these implants has an abutment. And the teeth sit on these abutments. And screws go through the teeth down into the abutments to hold the teeth securely. We're not talking about a one-tooth thing or a single crown or anything without an abutment. Pretty much every procedure, there's going to be an abutment of some sort, whether it's a milled abutment or a store-bought abutment. There's going to be an abutment.
So that's if there is no bone loss, but then if someone has bone loss, then we would place zygomatic implants.
Right, and I think we have a slide showing that
We
coming
do,
up.
yes.
Yeah.
And so that's for people with, no bone in the upper jaw.
Right.
So what are we looking at here?
So here we're looking at someone, and you don't see on the top, you do not see the tilted implants on the far right and the far left because the sinus has come more to the front, which negates the tilting. But these are zygomatic implants. So they go in more posterior, back in the molar area, and they go out to the zygoma bone, which is the cheekbone. And then you can see in the lower jaw where the implants are tilted, those have 30-degree angled abutments to straighten that tilt up. So this is a combination case of zygomatics on the top, tilted implants on the bottom, with 6 on the top and 6 on the bottom. So this is designed to hold the full set of teeth, top jaw and bottom jaw, and teeth would be attached to these the same day.
And then this is what we're looking at with the zygomas and how the teeth are screwed on. And then Carlo asked about his medication. So his primary care doctor says the Xanax that he takes for anxiety will not be a problem with general anesthesia as long as he lets the anesthetist know. Is that accurate?
That wouldn't be a problem at all.
Perfect. All right. Good questions, guys. And then we did not talk about quad zygomatic implants. So can you explain this case of extreme bone loss here?
Well, these are for people that don't have any bone in the front or the back. And if I had a little pointer thing, we could point out, but quad zygoma, no bone in the front, no bone in the back, no other option, simple, no other option that's simple. Quad zygomas are pretty simple, but this would require extensive bone grafting that would take, golly, long, you'd be fiddling around with this for a year trying to get something completed, whereas zygoma implants go in, no bone grafting, and you can attach teeth to them the same day. And they can be used on severely worn away upper jaws and upper jaws that have a little more ridge. They specifically work well for skinny ridges. Skinny ridge like 2 millimeters thick or 1 millimeter thick or something of that nature where there's not enough thickness to put the traditional implant in. So zygomas definitely have a place. We use them. I can't even tell you how many we do every month, but they have a huge place in our practice, and they work very well.
Yes, they are awesome.
I was going to talk about anesthesia too before we get away.
Yeah, let's talk about it.
But do we have any other slides related
Not
to
about
anesthesia?
zygoma. Oh, no, not about anesthesia.
Oh,
so
we don't?
we can just talk
Okay.
about it.
Because that gentleman's question, can you go back to that?
Yeah.
The guy that asked about the Xanax?
Mm-hmm.
So if you look down at the last sentence, let the nurse anesthesiologist know I take it. So in our practice, we have a chief nurse anesthetist, and she coordinates a group of 6 other nurse anesthetists, and they rotate around through our Lakeland office. We do about one of these each every day, and our Leesburg office, which has been dormant, is going to be coming alive again around the end of February. And we have nurse anesthetists who go up there to do the administration of anesthesia. So our nurses are all super people. When they're not working at our office, they have jobs in surgery centers and hospitals, and they administer anesthesia for all different types of procedures. When we're working in a person's mouth, the breathing tube has to go into the nose and down, and our nurse anesthetists are particularly skilled in the placement of the breathing tube through the nose. When I do procedures at the hospital where those people are not necessarily as skilled, it's always kind of a cluster to get the nasal tube in. But anyway, I wanted to point out nurse anesthetist, because that's who gives the anesthesia in our office. And these are highly qualified, highly competent people that do a great job for us. And, you know, for other doctors wherever they work. They deliver the majority of the anesthesia around this country, really.
Yeah.
Yeah.
And that's a really good question to ask if you are like having multiple consults is, you know, are you getting general anesthesia? Who's monitoring it?
Yeah.
Those are good things to ask.
Yeah, well, you know, in different states, the laws are different with respect to IV sedation mild, IV sedation moderate, IV sedation deep, and general anesthesia. So depending on the level of training, you know, different dentists are allowed by the state to do certain types of sedations and not general anesthesia. So, but that varies state by state.
Yes. We had a good question about some of the filler holes. So the video that was shown has some of the teeth where the screw goes in. Do those holes get filled in?
They do.
Yes.
They do get filled in. We usually, in the healing phase, we put in like a rubber cement where we can stick a sharp instrument in it and then just pop it out. But then later, we put some tape in those holes and fill it up almost to the top, and then put some light cured filling material in there so it's smooth. And that you definitely want them filled, or they'd fill up with food, and
Yes.
there'd be an odor
Yes.
from that. So yeah, they're definitely filled in.
That's a good question. And this is Dr. Richards' team. So these ladies help, you know, with surgery to post-op to all in between. If he is your surgeon, you will get to know these ladies very, very well.
They're all great
Yes,
kids,
they
as
are.
I say.
And then this is our restorative team at our Lakeland office. We have Dr. Nafala and Dr. Dibbs. And Dr. Dibbs is going to explain here in a video just how it is working in-house and working with a lab right across the hall from him, and how that helps the patient experience.
One of the things that really sets Florida Dental Implants apart from other offices that are doing full mouth implant reconstruction, I have my own laboratory here on site that myself and the other restorative doctors are able to use. This is invaluable. Having the ability to work so closely with my lab gives me the ability to better help my patients with the emotional side of it as well. A large number of the patients that come to us for treatment have had severe dental problems for many, many, many years, sometimes dating back to childhood. Because of the emotional concerns that they have, we really have to spend the time with the patient. That you can't rush anything. We need to have ample opportunity to have questions asked and answered. Having my own laboratory here on site, this is invaluable, not only in terms of having the control over the quality of the product that we're making, but the ability to, if I've got a question with the patient about, can we make this change? Is this going to be feasible? I can go across the hall, get one of my lab technicians, and all of my lab technicians have been doing this for many, many years. Bring them across the hall and they can talk to the patient themselves. So we eliminate the need for me to try to interpret the patient's concerns and questions and needs in a phone call or in a note. They can speak directly to the patient.
It was so important to me to have everything under one roof. There's no waiting. That is the advantage of having the lab on site. And they are so proud of their work that they come out to see the product. These are not regular people with regular jobs. These are master artisans that create. They truly are artists. And they're creating beautiful smiles.
It's like nothing I've ever experienced, and I don't know of any other office that's like this.
So as you can tell, it really does benefit the patient when we all can work together for the benefit of everybody.
Absolutely.
Yes. And I like to show this image, which just to show the power of zirconia. Now you even get them for your a temporary set of teeth too, which is awesome. But the zirconia is the teeth sitting on the very top, and the set on the bottom are made out of acrylic. And both of these teeth have been worn for 5 years, and you can see the difference immediately that the zirconia set look brand new, and the acrylic look like they need to be replaced. Most offices do put zirconia teeth in for the finals, but that is just something you need to triple check and make sure. And now that we have it for our temporaries as well, they're just extremely durable. They're very natural looking and like reflect light like natural teeth, so they're just a better solution to even temporaries.
I think some offices even do an upcharge to do a final zirconia in the end.
Yeah, that's true.
So you need to, who you're dealing with, you need to ask all those questions and make sure that when they give you a price that it covers everything that
Yes,
you
that is
think
true.
you think you're getting.
Yeah, because ours just includes the zirconia. It's all inclusive, and we will go over that in just a few minutes. But yeah, that's a good distinction. And then these are our implant coordinators in Lakeland. So we have Shauna, Chastity, and Allie. So you'll meet one of these ladies if you come in for either a phone consultation or in person. You'll talk with one of them, and they'll walk you through the whole process. And a consultation really looks like you'll come in, you'll have a CT scan done, and you'll talk with the coordinators. You'll look at your scan. Dr. Richards will come in. He will develop the treatment plan with exact fees. You can ask any questions. I feel like you'll leave knowing what is going to happen if you decide to have surgery, and that's the point of it, for you to feel comfortable and see your actual case and what would happen, and all of that. And we'll finalize the treatment plan at that time as well. Do you want to add anything on to the consult process?
No, I did want to talk a little bit about what happens after the procedure and
Yeah.
when they come back.
Yeah.
So let's say a person has surgery today and they went home with their printed teeth and they come back in about 10 days. And so we get out in front of them and they're sitting there and we look at them and we look at the midline of their two front teeth or the two front teeth in the middle of their lip or face or what have you. And we look at the tooth to lip relationship. We like to see a little bit of the tooth. As you get older, your face sags and maybe you don't see quite as much tooth, but we'd like to see a little bit of tooth up there. And we look at the lower lip to the lower tooth, If the lower teeth are sitting down too low, the lips can tend to roll in and you end up biting yourself. So we look, we make some suggestions, the person tells us what they like, what they dislike, and then we write up a lab order. It goes back to Roxy, our designer, and she takes the original files from the printed teeth and she changes those files and that design to the changes that we have requested. And she makes a set of zirconia teeth. So then the person comes back for their second visit in about another 10 days. We unscrew the printed teeth from their mouth and we screw the first set of zirconia teeth, the so-called temporary zirconia teeth. We put those in. We put them in, we look at them, we adjust the bite, and they're, most people are just, they remark, boy, these feel so much better, so much better. That's the teeth that a person would wear to month 2, 3, 4, or 5, or 6, maybe even, depending. And then out there, after the inside of the mouth, the tissue is healed, then we make the final zirconia teeth. And the final zirconia teeth will conform to the contour of the soft tissue to eliminate any gaps which may have developed during the healing. The other thing I want to say is that we are very liberal. I mean, making our patient happy is our #1 priority. And we run into some people, and they come in for visit #1, and we get to looking at them, and they go, well, I want this, I want that, and this, and I think we need to do this and that. And so when they start stacking on like 5 or 6 things that they want to have changed, we don't take them to zirconia right away. We might take them to another set of printed teeth. We might take them to a set of stronger acrylic teeth called PMMA teeth. We can make those quicker. They come back, we put those in. I've had some people, we've made them 10 sets of teeth. I'm not kidding you. But we get to the end. I mean, we get there to the end and we get them happy. And the point I'm going to make is you're not going to get that anywhere else. To where we will, we'll do backflips and stand on our heads or whatever it takes to make you happy. And if we have to make several sets of teeth to get there, then we make several sets of teeth to get there. It's just all there is to it. And so, we are driven to make you happy. And I think that's very important. And a lot of people will just throw a set of teeth in and say, bye.
Especially like the 24-hour teeth procedures and things like that.
Yeah. I've been around this game too long. I've gotten too old doing it to not have that kind of work ethic. And that's just, what we all have. That's just all there is to it. From the lab to the milling center, Dr. Kirkpatrick and his girls, I mean, we all have that same work ethic that, we're going to get you happy one way or the other. So, anyway.
Yeah. We had a question come in. Has there ever been a case where the body rejects the metal and it causes complications?
I am totally unaware of anything like that ever happening. The metal, meaning the titanium implants, I've never heard of that happening.
Yeah, it's super biocompatible.
Yeah.
Used in knee surgeries, right?
It'd be like a shoulder or a hip or a knee. It's the same type of titanium.
Yes. Good question. And I'll briefly go over the process, from start to finish. So like say you come in for a consultation, you decide I'm ready to move forward and you book surgery. The next step would be to come in for a pre-op and impressions appointment. And then you will have your day of surgery, which is that full day. And then you'll have a series of post-op appointments where you'll get your temporary zirconias and checkups and adjustments, things like that. And then we begin the process of creating your final zirconia teeth and then place the finals. And these are our key differentiators, which we did talk about in pretty good detail.
I think so.
So if you're doing any other research, this is kind of what sets New Teeth Now apart from other facilities, and that's all our surgeons are board certified, and they're oral surgeons. They're not just like dentists. We place a lot of zygomatic implants, probably more than anyone in the country. And then we exclusively place under general anesthesia as well. And then
I can't think anything to add to that.
yeah. We have additional resources as well. So I highly encourage you to jump on, our Facebook, our Instagram, look at some before and afters. You are on our YouTube, which is great. We have other webinars, other testimonial videos. And if you do want to talk to real patients, we have a New Teeth Now community. It's on Facebook, so you can type that in the search bar. It'll bring up the Facebook group, and jump in there and ask people who are going through the experience your questions, and they are more than happy to talk with you. It's a really great space to just get to know one another and ask those questions. But we thank you for being here tonight. Thank you for all the wonderful questions. We hope that everyone has a wonderful rest of the month, and we will see you next month.